Hello, it's Dr. Elisha Van Dusen with New Hope Chiropractic. Foot pain is such a common problem that 75% of all Americans will experience it at some point. With 26 bones in each foot, it's easy to understand why. Each foot also has nerves that send messages to the brain, telling it the precise location of the body. And this process, called proprioception, is necessary for the brain to coordinate the feet and other parts of the body to make the desired motion, like walking. Additionally, the feet bear the impact of a person's entire body weight, striking pavement or flooring thousands of times every day. This can easily result in damage to the bones, nerves, muscles, tendons, and ligaments that can cause significant pain. Ill-fitting shoes and disease, such as complications from diabetes, can also produce foot problems too. While foot pain is not always preventable, the good news is that chiropractic care can make it short-lived. Treatment typically consists of chiropractic adjustments, orthotic shoes, inserts, exercise, and other non-surgical options to reduce foot pain. Most people have either experienced or heard about plantar fasciitis. People with this ailment experience pain in the heel due to a strain in the ligaments that support the arch of the foot. This condition is named for the plantar fascia, a band of tissues that connects the toes to the heel bone. It also supports the arch of the foot. Ligament strains typically cause pain, swelling, and inflammation here. Traditional medical doctors often prescribe medication or give cortisone shots to patients that complain of plantar fasciitis. However, chiropractors take a natural approach to pain management. This might include adjusting posture, teaching people to balance their weight equally between their feet, and specific at-home exercises. Patients can find the fastest, most effective relief by working with both a podiatrist and a chiropractor oftentimes. Some of the other foot ailments chiropractor can help with include Achilles tendonitis. This is typically something that occurs after engaging in physical activity without stretching first. Chiropractors will have patients do specific stretching exercises to counteract the pain. Ankle sprains too can be more serious than they appear at first because they affect the muscles, tendons, and bone too. As the ankle heals, the talus bone may not return to its proper position. The chiropractor can adjust the talus bone to facilitate healing, and then we'll advise the patient to follow the RICE method, which stands for rest, ice, compression, and elevation too. Also, arthritis is another common issue in the foot. Although chiropractors can't cure arthritis, we can adjust the toes, the foot, and the ankle to reduce joint swelling and also possibly prevent further arthritic degeneration by making sure that the bones of the foot are properly aligned. Bunions also can occur. These are typically due to poorly fitting shoes, which can cause the big toe to move too close to the other toes. And chiropractic can help reduce the extreme pain and inflammation by adjusting and then mobilizing the joints of the big toe. Also, flat feet can be a problem. A person with flat feet has a noticeable lack of an arch. The whole foot is literally flat, and when he or she stands up, the entire foot hits the floor or the inside of the shoe, and this condition is typically present as far as early as childhood, although entry and normal aging can make it worse. And chiropractic adjustments and also properly prescribed exercises can allow the arch to increase naturally and prevent it from degenerating more. Foot pain is common, but it doesn't have to be inevitable. It doesn't have to hurt. So those who are not finding relief through ordinary means should really consider getting their feet and ankles checked and adjusted by a chiropractor. Check us out at newhopechiropractic.com if you're having foot and ankle issues, and we'll be happy to take a look at it and get you on the path to better health. Once again, that's newhopechiropractic.com, and have a very healthy day.